Comparing the United States to other countries across the world, we should be so ashamed of our maternal mortality rates. I was almost twice as likely to die giving birth to my daughter in 2010 as my mother was when she gave birth to me a generation before. I do the work that I do on maternal health because my own family was so deeply affected. My great aunt Katy died giving birth to her 5th child, a daughter, and she was far away from a hospital. After she died, her children were all adopted. We see much higher rates of maternal mortality in Black and Indigenous communities, in rural places compared with urban places. And those kinds of structural inequities that tear families apart, we need to right those wrongs. Unlike nurses and doctors, doulas provide help in the non-medical aspects of childbirth. And their work has been associated with all kinds of positive outcomes for people who give birth. We started off conducting research on doula support by working with a small community organization in Northeast Minneapolis. They trained doulas that looked like their clients, that spoke the same languages and came from the same communities. And they told me about their wonderful outcomes. Folks who had continuous support during labor from a doula had shorter labors, fewer cesareans, used less pain medication. It was just like overall a good thing. And that was like scientifically known, which is why it was a bit of a puzzle that folks didn't have access to this.
By 2014, more than half of rural counties had no place where you could give birth.
Birth is the most common and costly reason for hospitalization in the United States. And about half of all births in the US, all of those to lower income folks, are paid for by Medicaid programs. So adding a huge expense to the thing you pay for most often is a pretty scary thing to do. And it takes a very particular kind of evidence to convince someone to do that. And that is the evidence that we set out to create. And that research helped extend Medicaid benefits to include doula support in the state of Minnesota. We were so excited when the doula bill passed. And I remember just holding my daughter in my arms and knowing that if she gives birth in the state of Minnesota and she doesn't have enough money to pay for a doula, she will have someone there with her to help her and support her. It felt like we had come across the finish line, but in reality, we had just started. I would love to see us move forward with policies that apply to our neighbors, folks that may be different from us, that we would want to apply to us. People who are pregnant right now, about ready to bring new life into this world, what world are we gonna build for them? How can we not keep fighting? How is the future not worth it? How are our kids not worth it? They are worth it. Every day that I am weary, and I am weary through this pandemic and through these times, it's grueling work sometimes. And it is absolutely worth it every single day.